asking to please protect Social Security, Medicare, and Medicaid. We really appreciate it.
Thanks for working at this.
Yes, we are.
We're going to be working hard at it. We expect you to too.
Yeah, don't worry.
We're going to be watching.
We're going to make sure that Medicare is not destroyed.
No voucher, right?
No voucher.
Yeah, the vouchers is a bad idea, because what it's going to do is going to shift the cost increase of health care to senior citizens.
That's right.
And
I
frankly,
can't afford it.
And frankly, you know, I just don't think that's what we need to do. What we need to do is make sure that we do things to reduce costs, not shift higher costs onto senior citizens. And secondly, the idea that we're going to turn it into a voucher system that is given to the insurance companies, not a good idea. We've got to make some changes, no question, on Medicare, because it is, in fact, a huge problem in terms of our debt. But the changes can be made in ways that do not hurt senior citizens in terms of their ability to get health care. As I like to say, Warren Buffett can buy his own prescription drugs. Our country doesn't need to buy Warren Buffett's prescription drugs. People who are wealthy do not need the government to subsidize their prescription drugs. And there's other things like that we can look at to bring the costs of Medicare down so we can control the debt. But not on the table, as far as I'm concerned, is shifting these costs to senior citizens and turning the Medicare program into the insurance companies deciding when and if you get care and how much of it you get. So we're on it, and we're going to fight it. The Democrats in the Senate are going to fight it.
No raising the age.
No, we don't want to raise that age either.
65.
I mean, I've got to be really honest with you. If people who say Social Security is not a problem, we are paying out more in Social Security than we're taking in. Now, there's other things we can do.
Scrap the cap.
The cap, we've got to look at the cap. We have to look at the cap. We have to look at, once again, I think people that are very wealthy, they have the right to get back the money they've paid into Social Security. But I'm not sure that we should give them more than that. If they live beyond the time that they've gotten all the money back they've paid in, and if they're wealthy, then that's something I think we should look at. So I think there's a lot of ideas that we can bat around, but rest assured that I, along with a lot of my Democratic colleagues in the United States Senate, are not interested in destroying Medicare as we know it, and not interested in going back on our word in terms of what senior citizens can expect from Social Security. So
Thank you, Senator.
I want everybody to be honest about the severity of the problem, because it's severe.
It's severe.
Thank you,
Okay,
Senator.
guys, thank you.
Thank you.
Thank you.
Thank you.